Before starting your treatment with Kisqali Femara Co-Pack, make sure to read the Patient Information Leaflet from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You should take the ribociclib and Letrozole tablets by mouth, either with or without food, as directed by your doctor. Usually, you will take ribociclib once daily in the morning for 21 days, followed by 7 days off the medication. Letrozole is typically taken once daily in the morning for 28 days. This is considered one cycle of treatment, and you should continue taking the medications as directed by your doctor. Make sure to swallow the tablets whole and do not crush, chew, or break them. If you happen to vomit after taking a dose, do not take another dose on that day. Instead, take your next dose at the regular time. The dosage of Kisqali Femara Co-Pack is based on your medical condition, how you respond to treatment, lab tests, and any other medications you may be taking. Make sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To get the most benefit from these medications, it's important to use them regularly. Try to take them at the same time each day to help you remember. Do not increase your dose or use these drugs more often or for longer than prescribed, as this will not improve your condition any faster and may increase your risk of serious side effects. While taking Kisqali Femara Co-Pack, it's important to avoid eating grapefruit or drinking grapefruit juice unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects with ribociclib. Lastly, since these drugs can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or may become pregnant should not handle these medications or breathe the dust from the tablets. Some common side effects of Kisqali Femara Co-Pack may include tiredness, nausea, loss of appetite, vomiting, diarrhea, headache, constipation, back pain, hot flashes, unusual sweating, dizziness, or trouble sleeping. Your doctor may prescribe medication to help with nausea and vomiting. Eating small meals, avoiding food before treatment, or limiting activity may also help. Temporary hair loss and pain or sores in the mouth and throat may occur, but should improve after treatment ends. Serious side effects such as bone fractures, mental/mood changes, and signs of liver disease may occur, so be sure to tell your doctor if you experience any of these. Letrozole may rarely cause problems from blood clots, so seek medical help right away if you experience symptoms such as shortness of breath, chest pain, or sudden severe headaches. This medication may lower your ability to fight infections, so watch for signs of infection and seek medical help if needed. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before starting Kisqali Femara Co-Pack, it's important to let your doctor know if you have any allergies, especially to ribociclib or letrozole, as this medication may contain inactive ingredients that could cause allergic reactions. You should also inform your doctor about your medical history, including any issues with high cholesterol, bone problems, heart problems, liver disease, or kidney disease. When taking this medication, you may experience tiredness or dizziness. It's important to avoid alcohol or marijuana as they can increase these side effects. Be cautious when driving or using machinery, and limit alcoholic beverages. If you use marijuana, it's important to discuss this with your doctor. Ribociclib can affect the rhythm of your heart, causing a condition known as QT prolongation, which can lead to serious symptoms that require medical attention. You may be at a higher risk of QT prolongation if you have certain medical conditions, are taking other medications that can cause QT prolongation, or have low levels of potassium or magnesium in your blood. It's essential to talk to your doctor about using ribociclib safely if any of these apply to you. These medications can also increase your risk of infections or make current infections worse, so it's important to avoid contact with individuals who have contagious infections. It's crucial to discuss any exposure to infections with your doctor. Before undergoing any immunizations or vaccinations, be sure to inform your healthcare professional that you are using this medication and avoid contact with people who have recently received live vaccines. It's also important to inform your doctor if you are pregnant or planning to become pregnant, as these medications can harm an unborn baby. A pregnancy test should be ordered before starting these medications, and reliable forms of birth control should be discussed and used while taking these medications and for 3 weeks after the last dose. If you become pregnant, it's essential to speak with your doctor right away about the risks and benefits of continuing these medications. It's also important for women who are pregnant or may become pregnant to avoid handling these tablets or breathing in the dust from them, as they may be absorbed through the skin and lungs and harm an unborn baby. The use of these medications while breastfeeding is not recommended, as it is not known if they pass into breast milk and could pose a risk to the infant. It's important to consult your doctor before breastfeeding while using these medications and for at least 3 weeks after stopping treatment. It's important to be aware of potential drug interactions with Kisqali Femara Co-Pack 400 mg/day, 200 mg x2-2.5 tablet Antineoplastic Cyclin-Dependent kinase, CDK, 4/6 inhibitors. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any complications. Some products that may interact with these drugs include estrogens, tamoxifen, and tibolone. Additionally, other medications can affect the removal of ribociclib from your body, which may impact how it works. Examples of these medications include rifamycins, St. John's wort, and drugs used to treat seizures. On the other hand, ribociclib can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include alprazolam, ergot alkaloids, and triazolam. It's also important to note that many drugs besides ribociclib may affect the heart rhythm, such as amiodarone, chloroquine, and methadone. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Kisqali Femara Co-Pack and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share these medications with others. Before starting and while taking these medications, you may need to undergo various lab and medical tests, such as EKG, liver function, complete blood count, bone density, cholesterol, potassium, and magnesium blood levels. Make sure to attend all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, just skip it and take the next dose at the usual time. Do not take 2 doses at once to make up for the missed one. Keep your Kisqali Femara Co-Pack 400 mg/day, 200 mg x2-2.5 tablet Antineoplastic Cyclin-Dependent kinase, CDK, 4/6 inhibitors in its original container at room temperature, away from light and moisture. Be sure to keep it out of the reach of children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. Avoid flushing the medication down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.